Joining me now in this special telecast is Dr. Naresh Trehan. He's a chairperson and managing director of Medanta, the hospitals, the Medicity. And of course, he's a prominent cardiovascular surgeon as well. So my first question is, due to the dipping pollution levels, is the Medanta hospital reporting any specific or a higher number of cases related to pollution levels where the air quality has reached literally 500 and more?
Yes, that's very true that we have seen in the last few days the number of people who are visiting our pulmonary OPD has tripled because of the fact that there are three categories of people who are coming. One is people who have pre-existing lung disease and their asthma or bronchiectasis is actually being precipitated by this high level of pollution, because with the high level of pollution means that the particulate matter irritates the lung. So it's already damaged and it becomes much worse.
What protection would you suggest right away, of course, till the time we reach a solution? Whether do you think keeping them indoors is the best solution? Because then I feel bad for these children. You know, they've been during the pandemic, been indoors. Now it's the pollution. So it's not the childhood that a child should have in these states.
You see, indoor air is no better unless you have your affordable, that you can afford air purifiers. That it does help, no question. But the only way to protect the children today is, one, that during non-sunshine hours, because when the sun shines, if the sun is bright enough and it gets through, then it warms the gases and they lift. So the pollution level does go down in the middle of the day. Okay. But that doesn't mean, so what I'm saying is schools is okay in the sense that even if you don't have, most of the people don't have air purifiers at home, then, you know, there's no difference between classroom and this. But you have to travel by bus or whatever they do, that's a very high concentration of pollution. So now, the solution that we are asking for, which is the easiest, is that if we have become used to masks, even our children used to masks. So this 3, 4, 5 week period where we've experienced this high level of toxicity, I think the children wear masks to protect themselves. N95, even a triple layer mask will give you some protection, but nothing better than an N95 because it will filter out 95 of the pollutants.
And it's important people who are listening do adhere to that. Let's talk about, sir, the elderly who clearly have respiratory issues to a major level compared to perhaps the middle age. What sort of impact, how to protect, and, you know, are we also talking about beyond lungs and brains, health and heart issues here, that the pollution eventually does affect the heart as well, specifically of a certain age group?
No, exactly what happens to the lungs, we can also categorize the heart, because when these oxides get dissolved into the blood, they are irritants. And if you have pre-existing heart disease, naturally it increases, it passes through the arteries of the heart and irritates them. Point is, what you asked, construction, traffic, management, road cleaning, you know, the carpooling. I mean, and the advice of, say, for the next 2-3 weeks, work from home. There's nothing wrong with it. You did it for 2 years. So that's why we must go back into, this is one of the other additional nuisance of life, living in places like we do, that we need to go back to basics and say, okay, we protected ourselves in COVID, let's do the same protection for everybody, including our elderly, including our children.
Absolutely agree, and not correctly mentioning not just when it happens, but way before, so it does not happen and we do not have to live in a gas chamber. Dr. Naresh Trehan, thank you so much for your time and for helping us understand the sort of cases that are coming, what people can do. I hope the government is listening, I hope people are listening, and perhaps this will be the last of the polluted winter we have in the beautiful North Indian states of this country. Dr. Trehan, thank you so much for speaking to India Today.